Good morning. This is truly a full circle moment for me. I've engaged and have worked and collaborated with you all for some of you almost 5 years or more. And so it's a really special day for me to be able to talk with you all and continue the conversation, learn from you and elevate all of your incredible ideas and our partnerships together to the broader community. And so I'm really proud to kick this day off with Dr. Sung Pobleti, CEO of FAIR. Sung?
Good morning, everyone. I am so excited to see these faces in the room and to know that you represent a vibrant and much needed resolve to better the lives of food allergy patients and their families. FAIR's mission is to create a healthier, more supportive community for all individuals with food allergy, which can cause life-threatening anaphylaxis. Food allergy is a disease, not a diet. Our needs, and I say our needs because I also am a food allergy patient, span every space and environment. Today is about advancing awareness and health equity. There is a tenfold increase in food allergy across the world. In the United States, Black and Latino children have a higher risk of developing food allergies than non-Hispanic white children. We need to understand why. For the food allergy patient and their family, challenges abound in terms of accessing specialists, paying the cost of treatments, and sourcing allergen-free food options. We must eliminate these disparities. Patients can't afford to wait. No one should lack for information or access when it comes to managing their disease. Everyone should have a seat at the dining table with safe, delicious, and affordable meals. We're not here to commiserate over stories of food allergy experience and care. We're here to appreciate and even celebrate these stories. The food allergy community is resilient, creative, and present. We are showing up to be seen and to be heard. In addition to everyone here today, I want to provide a special thank you to DBV Technologies, whose support helps allow today to happen. We also want to recognize our Platinum's partner, ARS Pharmaceuticals. Now, I want to welcome to the lectern again, Anita Roach, FAIR's Vice President of Health Equity and Community Engagement. The FAIR Neighborhoods Initiative was founded on the understanding that scientific advancements must translate into community impact. Through her dedicated leadership, Anita makes sure that the pathways we create for better care reach food allergy patients and their families where they're at. Anita?
Thank you, Sung, and thank you for your fearless leadership and constant leadership on all we do with health equity. With that, I'm really proud to introduce my co-chairs for today and really all of what we do health equity-wise at FAIR. Dr. Edith Perez is a member of our board of directors as well as a member of our Health Equity Advisory Council, the co-chair of our Health Equity Advisory Council at FAIR, along with Dr. Andrea Papalardo. And they are going to help us start the day and give us some background for all of the rich conversations we're going to have today. So with that, I'm going to turn it over to Dr. Perez.
Yeah. Good morning. As we were preparing for this meeting, including a conversation last night, something that came up was, what are we going to do with this crowd? What kind of crowd are we going to get? And I tell you, it took me like 1 second as I walked in. I said, my God, there's a lot of energy here. I mean, I love this. This is just really fantastic. But I'm here really to talk about food allergies. I didn't know a lot about food allergies. I'm actually a hematologist, oncologist, and translational researcher by background. Well, I'm from Puerto Rico, that too. But, through, knowing Song, I got involved, with FAIR, proudly joining the board of directors, and then getting to know the team, learning a lot about food allergies and how much education and involvement we need to succeed in our quest, really, to educate, learn more about biology, as well as identify better options for therapy. And I had a chance to meet Anita and the team. So we're here this morning. So let me just say a few words about food allergies, and Song actually introduced one of these topics that is included in the next slide. But gosh, this is common. And I don't know if you have the same experience I've had, because since I became involved with learning about what FAIR was doing on food allergies, I talked to a lot of people about this. And most people do not realize that 33 million Americans actually have a food allergy. The other thing is that people don't know that this is a disease. They said, oh, yeah, if you manage your diet, it's going to be okay. And they don't understand the implications of having not only a common illness. Go to the previous slide still. I wanted to talk about the rates a little bit. Okay, great, here. 1 out of 10 adults, and then we think 1 of 13, children in the United States. These are big numbers. And we need to continue with the education so that people understand that this is not something that occurs rarely, because people say, well, how many people die? I mean, but the impact of a disease is more than the number of people who die. It's the number of people who are affected by the disease, the impact on their families and friends. But in addition to having a food allergy, it's an issue that, some of them can be very allergic reactions, which is really important for us to keep in mind. And there's a fear, an appropriate fear, of anaphylaxis occurring. It's a life-threatening risk that exists every day. So for me, being part of FAIR, trying to really understand, why does this happen? How can we get more involved? And this neighborhoods meeting is part of the trajectory to get us where we want to be. I don't have children, but I love children. And, to learn about how this disease not only affects adults, but at least as adults, we have an understanding of what's happening. And we can manage most of the time when people try to bully us. But children, obviously, are very vulnerable. And when children suffer from allergies, this just brings things, to another level. And I'm so happy that so many of the initiatives that are being conducted through this program are actually paying attention to children and schools, what's happening in schools. Last thing on this slide, it's in the bottom of the slide, but very important. I believe and I know that the amount of money allocated by the National Institutes of Health for food allergy is too small. We've looked at the figures. We've looked at what's happened to the budget of the NIH. Certainly, unfortunately, it's a very political issue these days, where there's a diminishing belief that science can provide us the answers that we need as a nation. But the budget of the NIH, although has increased some over the last few years, it has not been commensurate with an increase in the allocation of research money to deal with food allergies. And this is something that we need to be aware of. And really advocate for improvements to be made. Next slide. So, Song alluded a little bit to the issue of disparities, and you are well aware of these issues. But in addition to the risk that appears to be unequal amongst different groups, it's an issue of allergy referrals. It's an issue of availability of education, an issue of availability of potentially life-saving treatments that is not equitable in this nation. And I'm so happy that many of you are working to address these important issues. And it's more than a one-time consultation, a one-time discussion. This is a situation that deserves dialogue. That not only includes the individual suffering from the food allergy, but the members of his or her family, friends, and certainly schools, work, airlines, so many people. Next slide. So here, forward. Certainly not going backwards. Okay, here we go. So we have I'm very honored to be part of a great, health equity advisory council. And Andrea will be talking in a few minutes. But you see, many of you are here, and I want to thank you for your involvement. Just play a very small part of this, but I am honored to be working alongside with you to learn from what you're doing, leverage what you're doing, and continue to make progress on behalf of so many persons who depend on us to do our work. And when I looked at this, I tell you, I'm talking too long, but I just want to say one more thing. Just look at this. This is really an equitable panel, people. I mean, this is what every group should look like. And I'm just really proud also to be able to acknowledge this. Next slide. Isn't this cool? Go from fear to fair. Okay, better stop now. Have a good day. Andrea is here. Please come in.
I'm so sorry for my fat finger just pressing the buttons. So I'm Andrea Pappalardo. I am one of the only Medicaid providers in the state of Illinois that takes predominantly, it's a safety net hospital at the University of Illinois in Chicago. And then also I've recently been the director of the Mobile Care Chicago, which takes care of children and young adults and families in front of schools all throughout Chicago neighborhoods that otherwise would not receive referrals. So from the beginning when I realized, and I worked in private practice and academic practice and, community practice all over, that when I would see a patient in the hospital when I was in private practice, and the reason why I left is if they had Medicaid, I couldn't see them again. I was chastised and told that I was doing a disservice to my private practice that I was a part of because I wanted to see that person and follow up because it was the right thing to do. That was unacceptable to me and why I wanted to be a part of the solution. And that is why we're here today. Each one of you here is a part of this solution. But we can't do it individually. I can't do it alone. Anita can't do it alone. Justine can't do it alone. We all need to work together and say what works for you. What works for you, what works for me, all of these things can happen because I'm a physician, I'm an allergist immunologist, and I'm very lucky to have that knowledge. I have food allergy myself, my daughter does, but is she void of food allergy bullying? No. She came here last year and Carmen explained how she was bullied because she was allergic to mango at the time, and they tried to put mango in her mouth. And they said, oh, I thought you were allergic. Took it from one of her friends who forgot and brought the mango there, and then this young boy tried to put mango in her mouth. So this is a problem. And this is why we're here today, because this is enough. And there are not enough allergists to take care of this problem. And we cannot do it in isolation without community. And this is what FAIR is doing and bringing communities together and embarking in community-based participatory programming and research that allows for collective impact to be the goal. And if we can bring all of your expertise together, that is what we're doing here today. So hopefully my finger will allow for this to go forward and not 5 slides. So I wear a lot of hats. So I'm a physician who sees patients. I do research and I do implementation science research. And what that is and I do a community engaged form of this, is this to look at things from multiple levels, the socio-ecological framework. How do we translate policy into what our families see on an everyday basis? How do we get the LEAP guidelines, which if you don't know they are the earlier interventions, so if you essentially provide peanuts at a young age, you can prevent peanut allergy. And we know that we're not really good as pediatricians to telling people this, and many of our communities have no clue. And then even the simple fact of picking up the EpiPen and using it, the epinephrine, however form epinephrine, and getting that with you when you go places to eat are essential items that with a referral, which you might not be able to access because of the color of your skin, would help. So how could we conceptualize this and how, in a way that looks at every single level and how they interplay? And that's what Anita and her team have done, and it's beautiful. So we have the societal level. How do we shift culture and societal norms? How do you talk to your child who doesn't have a food allergy about your your position of how the school might be having some sort of peanut-free environment. How do you engage with the public about food allergy and in different ways? How do you then go to the organizational capacity? How does a food bank accommodate for those that have food allergy? How do we improve food insecurity issues so families who have food allergy and food insecurity aren't starving every single day and afraid that the only food they have might cause their child to have to go to the emergency room? Then we go to the interpersonal level where we connect through trust relationships. How do we get families to be able to communicate their allergies, communicate what's going on, and utilize their community resources in a way and producing the infrastructure for these resources to be elevated and disseminated and expanded. And Justine's going to talk about the beauty of this later today and what's happened in South Ward in New Jersey. And then the individual level. Having someone come to my ivory tower, which in UIC, it's not easy. So this is why I was part of this Mobile Care Chicago asthma van. That's part of the Chicago group, is that meeting people where they're at in front of schools is beautiful. I don't wear a white coat anymore. I don't do it. I sit down, the kids cuddle up with me, they give me huggies, and I love it, right? Because I'm meeting people where they're comfortable, where they can just walk right outside, go back to school. I go to the bathroom in the school, and all the kids see, a doctor cares enough to be there. And you see it in there. They look up at me. They say hi to me. They're not even my patients, but they know who I am, right? And that's beautiful. These are the multiple levels of which FAIR is working. And this initiative was based on all these levels. So where does it start? Community health workers are the crux of everything. Are you a community health? Is your picture there? Yes, I think it is. And it's a beautiful thing. But seeing it, you're like, there we go. So these individuals are how this happens. We can't go into a community and say, we know what's best for you. We have no idea. What is going on in the food allergy milieu? What do people need or want? What is there already? Most of the time you find the infrastructure is already there. It just needs to be connected and with one another. So between 2023 and 2024, the efforts in the multiple locations and the locations of where each of these, like Vicky's and Chicago and Central Arkansas, Ashley, et cetera, and going down, we have through all of these efforts in all these locations, 5,800 people receive peer-to-peer food allergy education. That's huge. That's a lot of people that would have otherwise not received it. 650 schools received free food allergy support and resources, and 606 food allergy patient appointments were made with Mobile Care Chicago. That's in Chicago alone. And so that means that children and adults were not going to get food allergy resources in 660. It's just one location, right? And so this is huge. And meeting people where that is how these individuals did this. And it's beautiful. I mean, I work directly with Vicki, and what she explains and does is just ideas that I would have never thought of. And it's so cool. All right. So let's see if this will go forward. So where are we? These are the locations we are currently, and many of you are part of these locations and or have had interactions with one of the locations or this Health Equity Council. And these locations are when the little dots are colored in a way that, like, the yellow means started in 2024, the blue was 2021, and that's Newark, New Jersey. And what is done in as a co-creation of community-based food allergy support and education and supporting allergy care navigation and access, getting people what they need when they need it, and training those who can be partners that will be able to carry this on, because, FAIR can't be ever always. And to really talk about food insecurity out loud and talk about what would work best within the community and with whom do we need to bring at the table all together to address food insecurity, and that intersectionality that somebody with food allergy has if they're going to get food from a food bank or wherever. And the community-based participatory research part is to document that. What are our communities need, and how do things change with some of these interventions? And it's important. And this is our collective impact. These are did it again. These are children that are making food, and it's a beautiful thing to make food together. I love it. Families have been doing it for centuries, and to make food that's safe, even for families that are not affected by food allergy, is important. Because I always talk about the kids coming over. I'm an allergist, so I'm lucky to have the first time someone's eating outside of their home in my home multiple times, because of their food allergy and the child and them feeling comfortable. And I would just go through with their moms. This is what I'm doing. This is how I'm preparing. This is the differences I'm doing to make sure your child is safe. But how can we make every child feel that way so they don't need to have an allergist, immunologist mom friend? You know what I mean? So like, you know what I mean? Like it was powerful. Honestly, it was one of the most powerful. I mean, I had my own child with food allergy, but I mean, obviously I adapted to that, but that was powerful. So these children are making, items with, you know, the free of the 9 made allergens. It's beautiful. Then hold on again. I want to show you the pictures of, the children that are the community health workers out in the world talking to families and providing information. And some of these informal discussions lead to much more, right? You know that, like, you know, you don't just jump into something and it's amazing. You have conversations, and that's what we're having today, is conversations about what we can do together to create solutions, because we know the numbers are bad. Edith just went through them. We know that this has been persistent, pervasive, and ongoing, but it doesn't have to continue that way. So how can we make it happen? And our cycle that we've worked on with community needs assessment, if it can go forward, is to determine what is going on within a space and to continue to study to understand if we're making an impact. So in Newark, where we have the most data from 2021 when we began into 2024 when we most recently did it, we were able to say, okay, do we have more allergy visits? We do. It's up 25 percentage points. More people with epinephrine prescriptions, up 38% points, because you have to access somebody to get a prescription. Doesn't mean you fill it. Then what happens next is more consistent and quick access to epinephrine, up 5 percentage points. We could do better there, and we're going to talk about that throughout the day, I think. And then difficulty obtaining allergy-safe foods. I think that was the opposite, right? No. Oh, people become more aware. That's right. So that's what we were talking about. So people were actually measuring more difficulty finding allergy-safe foods, and I think it's because it's awareness. So now you know. Exactly. Yeah. I was like, oh wait, was that? I read, see, I was in my mind changing it, and then we already interpreted it differently, which is, I think that it was a problem before, but it was just, if you don't know it's a problem, and you're putting yourself at risk, then you realize it is. That's right. We talked about that. And then we determine next steps. And this is a cycle that never ends, because just because something worked today doesn't mean it works tomorrow. And that's the beauty of what I love to do with FAIR, because, well, that didn't work. Okay, that's great. Why didn't it work? Let's talk about this more. Let's discuss what we can do to make it better. Because nothing is ever a failure. It's just an option to pivot in the learning experience. So I'm so excited to see what we come up with today. I am so thankful for you to fill this room and see what we're going to accomplish all together. So thank you so much.